A lot of babies experience jaundice, which is yellowing of the skin. In dark-skinned babies, you usually notice yellowing of the palms and yellowing of the eyes. Jaundice is common in babies. A lot of the time, it appears on the second or third day of life and usually clears by the 7th day or 14th day of life. It usually clears, and it's usually just a slight yellowing of the skin, eyes, and palms. But sometimes jaundice can be very dangerous, and that is why I want to talk about it. Jaundice in babies, which is neonatal jaundice, when it appears on the first day of life, within the first 24 hours of that child's life, it should be taken very serious. In fact, all jaundice should be seen by a healthcare provider. But particularly when it appears on the first day of life, when the baby's skin or eyes are very yellow, when their urine is dark yellow, if their stool is pale, if their stool, the feces is whitish, normally a baby's stool should be yellow or orange color. If it's white like clay, that's an emergency. You need to be seeing a healthcare provider, a doctor or a nurse practitioner immediately. Let me tell you, what causes jaundice essentially is that there's a substance that is produced when red blood cells, that's released when red blood cells, are broken down, called bilirubin. And normally that bilirubin is cleared by the liver of the baby. If that bilirubin level is very high in the blood, what then happens is that it can seep into the brain and cause brain damage, cerebral palsy. When it's caused by jaundice, we call it kernicterus. Okay, the child will have an irreversible brain damage. That's a devastating, debilitating complication that we don't want to ever see. So please, dear mothers, dear fathers, if your child has yellowing of their skin, yellowing of their, the palms, their eyes, you need to make sure you see your doctor. Now, your doctor will assess your baby and identify whether the child's bilirubin level is very high or not. That will help your doctor decide whether your child needs treatment, maybe use of phototherapy, UV light, or even sometimes taking part of the baby's blood and replacing it with fresh blood, what we call exchange blood transfusion. Your doctor will make that decision based on the information you provide and the doctor's assessment when they examine your child, and maybe when they do the blood levels to check your child's bilirubin level. Do not sit at home with a baby that has jaundice without seeking the advice of a healthcare practitioner, because prompt identification of high levels of bilirubin and treatment, adequate treatment, will help to prevent permanent, irreversible brain damage, kernicterus. I hope this video has been helpful. Don't forget to like, follow, and share this video.